deliver those services. I feel extremely fortunate to have an incredible team by my side every day, including the cabinet members leading the Emergency Management Agency, Public Health Department, Human Services, Children and Family Services, and of course my governor's office staff, all of whom are working day and night to see Illinoisans through the public health crisis that we're going through today. I just want everyone to know that when we talk about essential workers, that includes the many, many public servants who are among those saving lives and making life a little bit easier for all Illinoisans. As I announced a few weeks back, just like many businesses, our state agencies have directed many of their employees to work from home. In addition to Dr. Ezike, the three individuals behind me today, Secretary Ho, Director Smith, and Director Chapalavia, lead three of the agencies that provide critical services that our workers can't do from their homes. I've asked the three of them to join today's daily update so that you can hear directly from agency leadership about how they are managing to provide those services in the midst of the COVID-19 pandemic. For those who are less familiar with the workings of state government, there are frontline workers at these agencies who spend their days and nights caring for our most vulnerable Illinoisans, even in normal times. Those responsibilities don't go away during a global pandemic, and in fact, they become even more critical. At the Department of Human Services, for example, state workers at our mental health hospitals and centers for people with disabilities, developmental disabilities, continue to serve adults and young people in their care. At Children and Family Services, our investigators are protecting our children and families by responding to reports of alleged abuse and neglect that continue to be reported on our hotline. And for Veterans Affairs, our teams at our veterans' homes are ensuring that our state's military heroes receive the care that they deserve. I want to express my gratitude to these state workers who have made public service their life's work. They're still doing their jobs every day, spending hours away from their own families to care for some of our most vulnerable residents. They too are heroes. In just a moment, I'll have each of our directors talk more specifically about their department's COVID-19 responses, but here's what I can assure you across the board. Early action in all of our agencies helped to shape existing emergency plans specifically to the needs of our COVID-19 response. They put in strict procedures around visitors in state-controlled facilities, adding new staff, health checks and policies, directing as much of our PPE stock as we can to our state frontline workers, and communicating regular updates to family members and other designated contacts of those that are in the state's care. All of our actions have centered around a singular focus: protecting our most vulnerable residents and doing everything possible for their health and their wellness. Additionally, in agencies like the Department of Human Services and the Department of Veterans Affairs that have had to close many of their local offices that residents visit for services, we've enhanced our online and phone options to ensure a continuity of service. Our directors will give you the specific contact information for their agencies, but let me be clear, there are no DHS or DVA public benefits that require face-to-face appointments in the office at this time. We're working to increase access to services like Medicaid and food assistance to Illinoisans who find themselves newly in need of help. This is a really, really hard time, financially and emotionally, for adults and children alike, and overall for too many people all across our state. Please know that we in state government are working hard to support you in every way possible. Before I turn the podium over to Dr. Ezike, I want to remind you of one other thing. For 37 years, the month of April has been recognized as National Child Abuse Awareness Month in the United States. Because of the current circumstances, we have a harder time bringing the traditional amount of awareness to this important concern. But in this moment of heightened social isolation and stress, two of the key factors for the risk of child abuse. It is so important that all of us pay attention. Every child deserves a healthy childhood, to live in a nurturing, loving home free from abuse and neglect. Even during these times of social distancing and shelter in place, there are still simple things that we all can do to keep children safe and to keep our communities strong. Text or call a neighbor who is struggling. Offer to pick up groceries for a family and leave them on their front porch. Share tips for overcoming parenting challenges on social media. In these stressful, uncertain times, reach out to let families that may be in crisis know that they're not alone and that there is help available. So thank you, and now I'll turn it over to Dr. Ezike for today's medical update.
Thank you.
Doctor?
Thank you, Governor. Good afternoon. I'd like to begin today with a simple plea. Please continue to stay home. This will help Illinois flatten the curve, but we all must be willing to do this. You might say, oh, kids planning meetups outside but promising to social distance. We know how quickly that will devolve into someone showing something on their phone, and now you'll have 4 or 5 people encircling around a small phone. We all have to do what's necessary. The beautiful gestures that Governor referred to, dropping food at someone's doorstep, that's great. But the gesture of touching someone else, that's not what we want at this time. We can defer those moves now so that we can enjoy our connections later. Today, we have to report that Illinois has surpassed 10,000 cases of COVID-19. The number is sobering and reminds us that it's critical that we all do our part. The more cases means the more hospitalizations. The more hospitalizations means more deaths. So every gesture or gesture that we forego can help decrease our deaths. We added 1,453 new cases and unfortunately 33 new deaths. We have a total of 243 precious lives lost. We have seen clusters of cases in nursing homes, in assisted living facilities, correctional centers, mental health facilities, and developmental facilities alike. My colleagues and my friends from my sister agencies will be talking about the measures being taken to protect those residents in those facilities. And I want to touch on the difficulty of preventing the virus from infiltrating these congregate settings and the challenges of stopping that spread. The natural movement of people needing to come in and out of those settings, even when they're decreased to the minimum amount, still causes a lot of people moving around and increases the potential for introduction and rapid spread of the virus into people who live, eat, and recreate all in the same space. Options for medical isolation of these COVID-19 cases are limited and vary depending on the type and size of facility, not to mention the residents who are already in isolation for other medical conditions. Ideally, people who are positive should be isolated individually, and close contacts should be quarantined individually. However, that can't always be possible given the constraints of space and rooms. We are focused on helping these facilities and protecting the health and safety of their residents. Public health officials have been going on site to provide guidance on infection control practices, such as donning and doffing PPE, gloves, gowns, and masks. We've also tried to do most of our advice from phone, just to minimize additional exposures. We are working with medical staff and physicians who work in these settings on isolation and quarantine guidance and healthcare triage. Although you may not think so, everyone has a role to play and everyone can help. By staying home, you reduce the amount of virus spreading in the community. That reduces the chance of someone being infected. And that person may then go into a facility and have the unforeseen consequence of infecting a very vulnerable population. So let's all do what we can to prevent that possibility. Stay home, and let's be all in for Illinois and do our part to end this pandemic. And now a brief summary in Spanish. Buenas tardes, me gustaría comenzar hoy con una simple petición. Por favor, si puedes, quédense en casa. Esto ayudará a Illinois a aplanar la curva, pero todos debemos estar dispuestos a hacerlo. Hoy, IDPH informa que el Estado ha pasado 10,000 casos de COVID-19 aquí en Illinois. Este número no hace pensar y nos recuerda que todos debemos hacer nuestra parte. Desde ayer hay 1,453 nuevos casos de COVID-19, incluyendo 33 muertes. Tenemos un total de 10,357 casos y 243 muertes en Illinois. Hemos visto casos en todas partes, en asilos de ancianos y también en los centros correccionales. Los colegas de mis agencias hermanas hablarán sobre las medidas que están tomando para proteger los residentes. Quiero decir que es difícil para el virus que entra en estos lugares. El movimiento natural de las personas que necesitan entrar y salir de estos lugares aumenta el potencial de introducción y transmisión del virus. Idealmente, las personas positivas deben aislarse individualmente. Sin embargo, esto no es posible de hacer todo el tiempo. Estamos enfocados en ayudar a estos lugares y proteger la salud y la seguridad de sus residentes. Las oficiales de salud pública están ayudando sobre prácticas de control de infecciones. Aunque no lo crean, todos pueden ayudar en estas situaciones. Quédase en casa, reduce la cantidad de virus que se transmita en la comunidad. Por favor, si hacemos nuestra parte poner fin a esta pandemia, todos vamos a salir adelante. And with that, I will turn it over to Director Chapalavia of the Department of Veterans Affairs.
Thank you, Dr. Gazi, my friend, my sister, my hermana. You don't know how important it is that the Spanish language people get to hear your voice every day. We hold you in our prayers. Governor Pritzker as well, thank you so much, and good afternoon, everyone. The health and safety of our military veterans and those devoted staff who care for them is and always will be the top priority of the Department of Veterans Affairs under this administration. On March 11th, each of our veteran homes were directed to restrict all visitation to non-essential personnel. Our residents have been encouraged to stay in their units and minimize movement within their facility and are staggering mealtime whenever possible. All employees and essential vendors are subject to pre-shift health screening to include temperature checks twice daily. We are contacting all resources and stocking up on and reviewing protective equipment inventories, and everyone remains highly vigilant for any signs or symptoms of COVID-19. Thanks to the tireless efforts of Team IDVA, I love you all, we are grateful to have no known cases to date at our long-term care facilities. We are responding to a single positive case in an employee at our Prince home at Manteno, which is a standalone building on the Manteno property that provides housing and supportive services for our homeless veterans. The employee is home recovering. Our prayers are with them and their family. The home is following recommendations from local health officials with implementation assistance from the Department of Public Health to continue protecting everyone there. Our facilities are prepared for COVID-19 if cases do occur. We will work with the guidance from the Illinois Department of Veterans Affairs, our local health officials, to isolate, hospitalize residents as appropriate and protect other residents and our staff from transmittal. As we move forward, we are encouraging everyone to video chat, call, and write to their loved ones at our homes. We encourage you to visit our Facebook page at Illinois Department of Veterans Affairs and leave a comment or a message not only for our veterans, especially those that do not have family, but for our nurses, for our VNACs, for our kitchen help, for our household help. Everyone is important and everybody should be acknowledged. In addition to our homes, we have service officers to assist veterans who need help navigating the system of the federal and state benefits available to them and their families. Our physical offices have been closed, but our department remains dedicated to serving the needs of our families and our veterans. Any veteran can find their local service officer's email or phone number or fill out a web form to be contacted at our website. That's veterans.illinois.gov. Once again, that's veterans with an s.illinois.gov. Our veteran heroes and the devoted staff who care for them are strong and resilient. They know how to work hard and push through. With everybody working together safely and the support of our wonderful communities in Anna, Quincy, LaSalle, Manteno, in this administration, in this state of Illinois, we know we can get through this together. Thank you for being all in Illinois. I am proud to be not only on IDVA team, and I love you all, but also Team Illinois. With that being said, I'd like to welcome my brother, Director Mark Smith from the Department of Family, Children and Family Services to the podium. Thank you.
Thank you. Governor, thank you for your incredible support that you've shown the Department of Children and Family Services every day of this crisis. To my fellow leaders here today, your collaboration over the past few weeks has been inspiring. The network of organizations that make up the child welfare system in Illinois are completely dedicated to keeping children safe during this crisis. DCFS is central to the child welfare system, but we never do this work alone. Our partners in the private sector make up 85% of the workforce that protects children. Every day we work hand in hand with judges, state's attorneys, law enforcement, the ACLU, the Cook County Public Guardian, and with Child Advocacy Center, and with hundreds of social service organizations that support our children and families. Our internal emergency planning team has worked closely with other agencies like IDPH and IEMA, who are experienced in responding to infectious disease outbreaks. Together, we have made urgent and necessary changes to our system in response to the spread of COVID-19. Here's what that means for our families and the communities that rely on our system of care. Based on Governor Pritzker's decisive action to protect our state workforce, today, 88% of our DCFS workforce no longer report to an office. But even with that change, we are still providing the support that families and communities depend on. I am proud to announce that every call floor worker at the Abuse and Neglect Hotline for the past 2 weeks, every call floor worker has been taking calls from the safety of their home. In addition, we are allowing caseworkers to practice social distancing while they continue to check on the well-being of our kids. Starting on March 20th, DCFS announced new guidelines for caseworkers, residential monitors, and birth parents, giving them the ability to use phone and video to replace many of their in-person contacts with their children. However, the reality is, to ensure that we are keeping children safe, and some in-person contact must continue. DCFS has provided protective gear to our frontline staff and to the staff of our private partners who have asked for assistance. Over the last 2 weeks, DCFS has distributed more than 400,000 protective gloves and 15,000 masks and disinfectant and cleaning supplies across the state. We are continuing to work with IEMA and other sources to acquire more protective gear, including a shortage of child-sized masks. DCFS is extending services for any youth in care aging out of the system through this crisis, including any youth that have aged out in the last 6 months. This particularly vulnerable population needs the help of housing and other expenses, and we are making every effort to give them what they need. DCFS has also increased board payments to our foster parents for March and for April to assist in additional expenses they are facing. And we are providing additional funding for foster care, intact, and residential providers to assist with COVID-related issues. I share these examples to demonstrate that we are rapidly adjusting our system to care for so we can balance the needs and reduce the spread of the virus. With ever-present needs to protect our children from the dangers they face, even in the best of times. This work will not end. DCFS will keep adapting and responding to changing nature of this crisis. And with this action we must all take as a society, we will continue to assess how these disruptions bring new threats to the well-being of our state's children. There are countless heroes who are serving on the front lines every day to protect us from the coronavirus. Among the medical personnel and first responders, let us also count child protection investigators and caseworkers who leave their homes bravely every day to protect the children from the harms of abuse and neglect. I would like to personally thank every DCFS employee from our fiscal department who ensure checks go out, to our IT partners at iDoIt who have ensured that we can continue to protect and serve our children, and to every child protection investigator and case manager who has put themselves in harm's way to protect our children. And most lovingly and supportively, our foster parents who have kept and maintained the care for Illinois' children and stepped up as a true leader in the demonstration of the heart and love we have for our families. Thank you. I'd like to welcome Secretary Hull to the podium.
You've been listening to a press conference with the governor of Illinois, as well as a couple of department heads for the state. We've learned that the state has more than 10,000 cases at this time, 1,453 new cases, 33 new deaths, bringing the death toll for Illinois to 243 deaths. The director of the Department of Public Health called those numbers sobering and says that the state continues to plead with people to take this seriously and continue to practice social distancing. We will bring you the latest on our app, online, and on air. Our next newscast is at 5 o'clock.